Thank you, Chair. Good afternoon from everybody. My name is Angele. It means angel in English. I come from DRC, from Congo. I am not good in English. I can speak, but to understand is difficult.
We shall understand.
It's an honor for us to introduce this study that we realize in the city of Lubumbashi, in the Democratic Republic of the Congo, on the social consequences of unaffordable costs for obstetric care on households and health facilities. This is the plan of our communication. In DRC, user fees for obstetric and neonatal care are too expensive for households holders they are paid, and they lead to catastrophic expenditure. In fact, in this country, there are no mechanisms to cover the healthcare costs for poor and poorest. The aim of the study was to explore the social consequences of the high financial cost for obstetric complications on households and health facilities in the city of Lubumbashi in the DRC. We realized it in the maternity of 3 facilities, 1 private health center and 2 general reference hospitals. This is a qualitative study. We used a semi-structured and iterative individual interviews to collect data. We included 8 mothers, 2 accompanying persons, and 4 health workers. All mothers selected at complication during delivery and had to pay the fees directly at the place of care. Those selected at general reference hospitals have had cesarean section and were held there for no payment of this care. We developed these following themes: difficulties of payment of care, strategies of recovery of the funds, change of lifestyle on the household, relationship within the couple and the family, healer-healed relationships, representation of mother on childbirth. Here are the characteristics of mothers, newborns, and care. We have noticed that the average length of stay at the maternity was 3 weeks. The average financial cost of delivery was $21 at health center and $243 at general reference hospital. When the cost of obstetric complications become unaffordable, we have 2 situations. The first, households can fund money. It can have help from relatives and friends. It can sell property. It can borrow. It can spend all its income and sacrifice food, rent, or schooling. It will surely become poor, but it will pay for the health care. Second, if the household cannot find money, it cannot pay for the health care, and the mother and her baby are held in the maternity. This situation further impoverishes the household, and we observe these consequences: an extended maternal absence in the household, a decrease in family income, conflicts in families, and the spouse abandons the household. For example, one mother told to us, "I don't know what to do for the other children. I have 7, and they stay alone at home because their father is a motorcyclist and he stays in town for a long time to fund the necessary. Only 2 of them go to school. My oldest daughter hasn't become pregnant." Health workers said, "It's the mother who sold tomatoes, vegetables, or the hambers who found herself in the hospital. The husband is a contractor. His salary is insignificant. If he's not taken for a daily job, he is at home and he has nothing." In the health facilities, we also have observed an increase in the length of stay, a disrespectful care, and the loss of the expanded profits. One mother told to us, "They separated me from my baby and only called me to breastfeed. I beg, I ask them to trust me. I cannot run away. I will stay in the hospital since the removal of the wires is still incomplete. When the child is in neonatology without treatment, we have to pay the beds, and the cost of care increase. I cannot escape. I just want to get my child back." The health workers said, "Women often escape without paying, especially if it's a case of stillbirth. To escape, women put their babies in a bucket or even in a bag and they run away. Sometimes they simply arrange with the sentinels who are not well paid, and they leave easily." But despite everything, for respondents, childbirth is a blessing. Childbirth is a natural phenomenon, and childbirth must be supported by the government. Mothers said, "I cannot stop it alone. It is not good. It is God who gives the children." But health workers told, "The woman who came to give birth has a husband, so she should be able to pay for her care. We don't accept indigents at the maternity. If need be, the government should pay for the health care." Several other qualitative studies demonstrate the social consequences of unaffordable cost of obstetric care in Mali, in Burkina Faso, in Bangladesh, in India. But in DRC, the government should implement a long-term policy of subsidizing care and associate it with a system of risk sharing. This will help to focus care on patients and improve the physical, mental, and social health for mothers, their babies, and their households. In fine, in DRC, the cost of obstetric complications is unaffordable and leads to social consequences on households and even health facilities. The government should review its healthcare financial policy to ensure access to quality care for all. The process of setting off of free care is underway in our country, and we really hope that it will be soon effective. Thank you very much.